Hi, this is my presentation on ailments, annoyances, and emergencies that might occur in yoga. The first one is newbies. We have Martha here. She's a newbie who read about hot yoga on Facebook and wants to try a class, but she's not sure if she'll be able to keep up. So I told her, you're going to love hot yoga. Just follow my instructions, and if you need a rest, lie down in Shavasana, and I'll show you how. And this is a powerful pose with many benefits. Pretty soon you'll be seeing yourself do more and more poses. And then let's talk after class to see how things went. Our student here, Andrea, just finished class and she let me know that she had a terrible headache. And she said actually she often gets headaches after hot yoga and she's starting to get concerned. And what I told her is when you do hot yoga, your body needs more water because fluids and minerals are released from your body. So try drinking half your body weight in water every day, but especially on the days that you're doing yoga. We also have a product called Soleil, a Himalayan sea salt um, solution that we just put a teaspoon in the water, and that helps you to replace some of the minerals that you've lost when you sweat. Tiredness. We had one student that said, I'm so tired after I do hot yoga. And what I told her is if you're tired after class, that's not necessarily a bad thing. Your body is cleansing and it's hard work for your body. So just stay hydrated and don't worry about it. Fever. A woman named Mary came to the studio and she said, I have a fever, but is it okay if I take a class? And I said, no, I'm sorry, you can't take a class today. Your fever can make you dizzy and dehydrated. Why don't you sit down and drink a glass of water? And I'm going to put a little Soleil in it, a Himalayan sea salt solution. Did you drive here? Because if you did, I'd suggest that you take an Uber home because it's really not safe to drive with a fever. A woman named Rebecca came to the studio and said she has a sinus infection that kind of developed over the course of the day, and she had planned on taking a class and she wanted to know if she should take a class. And I said, sure. Many of the poses in hot yoga will actually clear up the congestion by increasing circulation. Just when you're doing forward bends, go down and come up slowly because your head might throb because of that congestion that you have in your sinuses. Surgery. Lisa came to the studio and shared that she recently had surgery. She wanted to know if it was safe for her to do it. It turns out that after asking her what type of surgery, I found out that she had knee surgery. And I told her that surgery creates scar tissue, tightness, increased sensitivity, but hot yoga can bring oxygenated blood back to the area, breaking down that scar tissue and giving her back some range of motion. But be patient, follow instructions, and go slowly. Don't push yourself after you've gone through surgery, which is a trauma. High blood pressure. Amanda came to the studio and asked if she could take hot yoga classes. She recently found out that she has high blood pressure and was prescribed an ACE inhibitor. I suggested that she first ask her doctor what he or she thinks. In general, hot yoga does improve the circulatory system and can help balance your blood pressure. But of course, if you experience dizziness, shortness of breath, chest pain, chest pressure, lie down in Shavasana. And also be gentle in back bending poses. Don't do floor bow either. Just lie in Shavasana during that time. Wendy came to the studio and shared that she had asthma and needs an inhaler. And she wanted to know if it was okay to take a class. And I said, you can absolutely take a class and bring your inhaler into the room. And you might even find that you don't need it. In fact, one of our teachers found that focusing on her breathing and combined with the heat in the room, which relaxes muscles and nerves, was actually very helpful in relieving her asthma. Holly came to the studio and mentioned that she had back problems. I thanked Holly for sharing and asked for a little more information since back problems is such a general category. It turns out that she doesn't have a herniated disc, just has lower back pain from time to time. And I mentioned that she should go slow during back bends and forward bends, but to engage her core whenever possible, because when you have a strong core, it's the best thing for your lower back. Brendan arrived at the studio and shared that he had sciatica, and he wondered if hot yoga would be good for him. And I mentioned that I had sciatica due to uneven hips before I started doing yoga, and it's gone away, and my hips were realigned, and they've remained that way. There are a few things to do, and they're mentioned in the script. You keep your toes pointed forward rather than pigeon-toed during Dandayamana, Bipak Tapanda, and Paschimottanasana. But hot yoga can be great for alleviating sciatica, and I've experienced that myself. Molly came to the studio and shared that she had scoliosis, and she wondered if hot yoga would be good for her. And I told her that hot yoga primarily focuses on alignment of the spine, so it can help with scoliosis. But again, go slowly, and she should do the best she can in each of the poses. Charlotte came to the studio and wants to take classes, but she mentioned that she just underwent spinal fusion. She'd like to know if she would be a good candidate for hot yoga classes. Well, I insisted that she must get a doctor's approval before taking classes, but if her doctor said it was okay, he or she would probably tell her to avoid twisting and backward bends. So, of course, always follow your doctor's instructions and lie down in Shavasana during poses that you were told not to do. Knee injuries. Colleen came to the studio and mentioned that she had a torn meniscus and she wanted to know if she could still do hot yoga. I told her there's no problem with hot yoga if she listens to the script. For 2 of the poses, we have special instructions for people with quote-unquote bad knees. Also, contract and lift the thigh muscle upward off the kneecap during balancing poses, and this will help strengthen the knees. Eric came to class and shared that he had plantar fasciitis. He wanted to know if he'd be able to do hot yoga. And I mentioned to him, plantar fasciitis is all about stretching. So hot yoga can definitely help by strengthening ligaments, tendons, bones, and muscles of the foot. While the plantar fascia is inflamed, standing on one foot can be painful. So during those poses, if you're experiencing pain, just stand in Shavasana and before class, Pamela mentioned that she had her monthly period and wondered if it was a good idea to take a class. And I said it's perfectly safe to do hot yoga when menstruating. Headstands and shoulder stands are normally contraindicated, but we don't do those extreme inversions in hot yoga, so you'll be fine. Paula mentions that she often feels nauseous or dizzy during yoga class. And I responded, if you feel nauseous or dizzy during class, just lie on the floor in Shavasana until the feeling passes. It's probably because of a lack of electrolytes and underhydration. Always drink half your body weight in water, particularly on days when you're taking a class. You might also add a teaspoonful of Soleil to your water. This replaces a lot of the minerals that you lose when sweating. Rita is a new student and she expressed concern about doing yoga because she's overweight. And I let her know hot yoga is great for balancing your weight, especially if you practice 3 times a week. Once your digestive system balances, you might find that you don't want certain foods that are contributing to the extra weight. And like any exercise, yoga will turn fat into muscle and redistribute your weight. So even if the scale doesn't move, you might feel better in your clothes. Richard shared that his hamstrings are very tight, which makes certain poses difficult for him. I found out he's an avid runner and does 1 or 2 marathons a year, so he's often practicing. And I told him hot yoga is excellent for runners because stretching is so important and it forces you to do it for either 60 or 90 minutes. But follow the instructions and breathe deeply because when muscles aren't getting the oxygen they need, they can spasm or become painful. And bend your knees slightly if you need to during forward bends. You'll stretch those hamstrings little by little. Roger came to class and mentioned that he has a herniated disc. He wants to know if he should avoid any poses. When doing forward bends, go forward slowly and bend your knees. When doing backward bends, lift from your chest and lengthen your spine, relieving pressure between the vertebrae. And no sit-ups. There's alternate instructions that I will give you when we get to that point in the class. Wendy mentions after class that she's having a problem with some of the frontal poses, and that is probably related to her breast implants. And I told her if you're having difficulty with frontal poses, you can create what we call a Shavasana pillow. You put your elbows out, hands on top of hand, and create a little pillow for your cheek, and that'll lift your chest up a bit. Gretchen is pregnant and would like to start doing hot yoga. And I told her, unfortunately, you can't start doing hot yoga right now. There is a pregnancy hot yoga series with alternate poses, but it's only recommended if you already have a regular practice and are in your first trimester. But feel free to come back as soon as you can after the baby is born. Mary Ann shares that she has arthritis and is wondering whether hot yoga is right for her. And I responded, hot yoga is great for arthritis. It tones blood vessels and increases blood flow. But be gentle with yourself and lie down in Shavasana if you experience any discomfort. And here's some emergencies that unfortunately can occur during class. Andrew fainted during yoga class. So I put the class into Shavasana, stayed calm, called 911, called Rhonda after I got off the phone with 911, and stayed with the student until the paramedic arrived. And in this case, there was not another teacher in the class, so the students had a very long Shavasana. Robert had stopped sweating, his skin was white, and he was having trouble following the cues. And I determined or felt that he was overheating. So I took him into the back changing room to lie down and instructed the other students to lie down in Shavasana. Luckily, there was another teacher in the class, so she accompanied him into the changing room. She met me in there. I retrieved the cold compresses from the freezer and brought them to the back room, and the other teacher placed the compresses under the armpits, forehead, wrist, chest, back of the neck. I called Rhonda and then got back to teaching the class. About halfway through a class, it was obvious that Maria was suffering from dehydration. She wasn't sweating, and I could tell she was wobbling on her feet. So I asked the class to lie down in Shavasana. I took her into the changing room and stayed with her. I sent a student to the front room to get frozen water bottles and apply them to her forehead, wrists, under the armpits, chest, back of the neck. And at the same time, I was calling 911, and I kept Maria talking and conscious. And then after the 911 call was complete, I called Rhonda. Marcia was having trouble breathing. I encouraged her to lie down with her eyes open in Shavasana and guided her to breathe deeply with a closed mouth, no panting. I asked the rest of the class to lie down in Shavasana until she was breathing normally so I could help her with the breathing and keep